Evelyn Cruz, who I know personally and is just a gem. Evelyn is a community health worker here in Austin. She currently works for Central Health, which is a public hospital district here in Travis County. They support and provide funding for insurance for people who otherwise do not have access to insurance. Evelyn is extremely qualified. She has over 20 years of work here in Austin in various capacities. She's previously worked with people experiencing domestic violence. She's really just a true member of the community and is very passionate about helping people navigate the medical system. She is bilingual and has done a lot of work with me for people who have kidney disease. I've spent a lot of time with her in clinic, and she is going to tell you about her work as a kidney disease-specific community health worker.
Good morning, everyone. Thank you, Tessa, so much. I have had the privilege in working with Tessa and receiving education from her and being in clinic with her, so that has been such an honor, and just learning from her, so thank you so much. So yes, I am going to talk about some of my experiences with providing CKD education to at-risk patients, but also for patients that are currently sort of established, have been diagnosed with chronic kidney disease. And my hope is to sort of also create education for those end-stage renal disease patients that sort of still have questions. The agenda for today, we're going to be talking about a little bit about the community history, the community health worker history, community health worker definition, some CKD education, and individualized education, benefits of community health worker, some challenges, and a poem. In doing some of my research, I was really interested in knowing that community health worker has been around for as long as it has. So the first showings of community health worker were back in the 30s in China from farm scholars. And these were actual community members that were providing actual medical care and also providing education. So I found that really interesting. And then as the time has gone and the years have gone by, we've really kind of incorporated that here into America and have really had an increase of community health workers. So a fun fact, here in Texas, primarily, there are 4,139 actively licensed community health workers. The definition of a community health worker. A community health worker is a trusted member of the community who empowers their peers through education, connections to health, and social resources. Some of the things that community health workers can do are creating more effective linkages between the communities and the healthcare system, providing health education and information, assisting in advocating for underserved individuals to receive appropriate services, providing informal counseling, and directly addressing basic needs, and building community capacity in addressing health issues. Some of the individualized, and this is actually something that I was able to do as I was working with Tessa, is meeting with her patients and seeing sort of every patient is different, so they all require more individualized. So providing this education to them and really meeting them where they're at. One of the things that we created within the organization that I work with is we have sort of an initial assessment form that we use, and we really use that for a couple of things. One is that we're trying to engage and have a good rapport with this patient, and so for us to know, the patient's status, to know family size, the language that's spoken, their children's information, and really just having renal stage information. Are we providing preventative education? Are we providing CKD stages, or is this education for end-stage renal disease? What are their risk factors? basic needs, this is a really important one, having us knowing if there's any food insecurity, housing, transportation needs, and this is really, really important just because a lot of the times you will have patients who are so focused in this need because it is a barrier for them that we always want to address those needs first prior to us giving them that education. And then we have intervention provided. So following and getting to know them, we want to know, what information did we provide to them? We provided basic diabetes education, the different stages of CKD, and even some basic dietary needs. Another is plan of care, like what are our next steps? What do we want to discuss with our patients? And then our next follow-up with patients. And this is something so that patients can also know what to expect from us. And CKD education, this has been really helpful just to provide a visual for some patients. I know I'm a visual learner, so sometimes I'd like to have, for those patients that are able to follow along with me, to provide them and knowing what particular stage they're in. So, if it's a patient that is in stage 3A, 3B, really wanting to give them the definition of what that means, what does that look like, and having something that they could keep at home, because oftentimes they could read that with their families and really just take their time in understanding that, and then if they have follow-up questions, we'll have those follow-up meetings. Again, this is another just CKD education, kind of going into, and then this end-stage renal disease one, I really appreciate sort of these visuals because it really is helpful for the patient to kind of see visually what that looks like when they're in that stage, because they often hear stories from other folks, and I think they sort of build in their mind what that looks like. So just to have that is also helpful. Some of the helpful handouts that I use is Tesha had included that GFR, just knowing the different types of testing that is given, the different stages of chronic kidney disease and what the functionality of that is. One of the best forms or handouts that I have received from my patients is this healthy plate, just knowing the healthy foods and knowing what they're able to eat. And then the kidney action plan is something that I think was really, really helpful. It was already created by NIH, but I made it sort of where we can individualize it and really know that this is what the provider has suggested, this is their goal, and what steps they can take in order to be more physically active, and so that they have that as a reminder to continue their care. The benefits of community health worker is to provide, serve, improve, assist, and reduce. Provide culturally competent care, serve populations with limited English proficiency, improve healthcare quality, assist with chronic conditions, reduce provider burden. And I wanted to touch a little bit more on reduced provider burden, just as I was given the opportunity to kind of work with Tessa in clinic and see providers are given a very short amount of time to engage with their patients. They're given maybe about 20 minutes to kind of discuss, and so oftentimes it's really hard to provide a lot of information, have the patient ask their questions, and sort of really feel like they understood. So for providers, there's a lot of time constraints, so they don't have the time to really dive deep into knowing sort of what is going on in their home to provide this information. And so one of the things that I've noticed just working with Tessa and seeing in clinic is, information is being provided. However, and some of the patients that I've worked with, I'll just give a brief example of, I had a woman who, she's a this is actually a man, I'm sorry, 67-year-old man who has attended all of his visits with Tessa, and she felt that it was important for him to receive further education. And as I met with him, he started to relay some information that he was living in a small room in a friend's mechanic shop. This was a 30 to 45-minute walk to a bus stop. He didn't have a refrigerator. He didn't have any location. He didn't have anywhere to store his medications. So all of this information is things that, unfortunately, Tessa was unaware of and she wasn't able to receive from during those visits. And so as we're, really doing these assessments, we're kind of having a better understanding of sort of what those needs are. And so I'm able to relay that information to the provider, and then they can make the proper adjustments, which in this case, they were able to make some adjustments to his medication. The challenges of communicating this information is complex. So CKD is very complex, and so it's a lot of information. And so oftentimes patients are struggling to really understand what that means. And so also being in clinic, we had a woman, this is a 63-year-old woman, diagnosed with end-stage renal disease, has been receiving dialysis for some time now, and during one of her treatments, and even during her vascular appointment, when she was about to receive her fistula, she was asking if how many more treatments did she need before her kidney was better. So, you were really kind of getting a sense that even as they're been on dialysis, they're still requiring education because it is a lot of information to sort of process. And then competing management and education demands. Some of these patients have multiple chronic conditions, so it is oftentimes where they get confused on the information that they're receiving from one provider to the next. So having a community health worker, I think it just helps sort of reiterate and remind the patients that what specialty, what information was given for providers. What are some of the challenges? We have social conditions, social circumstances and depression, challenges in the home and understanding fearful behavior, mental health status, depression in patients, denial, patient adherence, lack of patient compliance, lack of understanding, and lack of affordability, work environment, lack of feeling comfortable, secure, and ease when it comes to both their physical and emotional safety, and communication, patient perception, patient interaction, and language barrier. This I have found extremely important for community health workers. So importance of continuing education for community health workers are beyond the recertification and licensing. Continuing education plays a crucial role throughout the careers of community health workers as their patients will receive improved health care and subsequently better outcomes. We, aside from us needing to maintain our certification, this is really helpful for us to be able to further continue to provide education, to have these refreshers every year and making sure that we're up to date with some of this education. So if there's any continuing educations for diabetes, hypertension, renal disease, medication adherence, any of that is really beneficial and helpful. And then personally for the motivational interview, I think that is really helpful to be able to kind of build on those skills and know how to sort of engage with your patient and create that rapport with them. And then lastly, and this is in honor of Community Health Worker Day, Governor Greg Abbott has declared Community Health Worker Day here in Texas on April 14th. So during my research, I found this poem and I just thought it was really fitting and really wanted to dedicate this to all of my fellow community health workers. You are unique in this world. Almost prancing, joyful and dancing, you walk our streets observing, yearning to know, eager to share. dreaming to see the light of dawn, your dream come true, our world better off. You are unique in this world and you don't even know it. To the neighborhood and family, you surrender your heart. No one is at all beyond the reach of your hands. With heartfelt voice proclaiming, you offer hope, courage, and health. You are unique in this world and you don't even know it. You are a hero, our neighborhood inspiration. You are unique in this world and you don't even know it. You are a leader, your family and your neighborhood salute you. You are unique in this world and you don't even know it. You are a great listener. You are the one who knows how we feel, understands our pain. You are the one who has the courage to change in the world. Today is the day. I'm telling you now, you are unique in this world, and I want you to know it. Poem. And that is it.
Isn't she great? Thank you so much, Evelyn. I will say that I feel, as a physician working in a federally qualified health center, my ability to help people is extremely limited. The man that Evelyn mentioned, he came in 5 or 6 different medications, all maximally dosed. His blood pressure was impossibly high, and it wasn't until Evelyn was able to actually go to his house and tell me, oh, you know, Tessa, he lives in a mechanic shop. He basically doesn't have a refrigerator. He's also blind. So all of these people are prescribing him all of these medications, including you. And I was going to try to add another one, and I can't do my job without knowing these things, and it's truly the community health worker who's able to go and help people. So it's not just CKD education, it's the wraparound holistic care that you all are able to help with that is essential. So we're going to hear now from Claudia Camacho. Claudia is a patient navigator for the University of Colorado. She works with Dr. Lilia Cervantes and some of the community health worker research that she does there. She specifically works with Latinos with kidney failure, including people who are receiving in-center hemodialysis. She has a bachelor's degree in anthropology, and she's currently aspiring to attain a master's degree in public health. So, thank you.
Hello, good morning, everybody. Hold on. Okay. So, thank you, Dr. Novik. My name is Claudia. I'm a patient navigator working for patients in dialysis right now. We have no disclosures. I have no disclosures. This is my agenda today. I'm going to talk. I'm kind of, listening to the speakers. I'm kind of like my work. It's I'm just going to give an example of the community health workers. I feel like the work that I'm doing. It's all this. So this is the agenda. This is how I got here. I'm originally from Mexico City, came here as a young adult, been working for Dr. Lilia Cervantes. I'm going to share some experience, real experiences with patients, including my dad. My dad was a renal failure patient that didn't survive, and that's how everything started. And then lastly, we're going to talk about some changes that have been happening in Colorado, which is amazing. Kind of sharing some pictures. I immigrated here to the U.S. back in 1989. I encountered myself when I was 19, went to the doctor, and had an medical emergency. Didn't speak English very well. The person that helped me there, the community health worker, was very rude to me. I feel really bad. But what else? I didn't have anything else to do. I mean, I had to be there. I had to attend that emergency. I didn't understand, really. I thought that's the way we needed to get treated because I was an immigrant. So I just went ahead but I feel bad. I feel bad. I feel unwelcome. I feel like I didn't belong here. But I was only 19, so what was I supposed to do? Time went by, started working at the hospital. Denver Health was the first hospital that I worked. I worked as an interpreter. I help patients. Actually, I started working as a admission clerk. I got hired at the hospital because I was bilingual. At that time, I already had learned English. So I got hired at the hospital because I was bilingual, helped patients in the admission part, and then I moved to be an interpreter. I interpret for people, Spanish, and that's what I met the patients that needed a dialysis and they couldn't apply for government benefits, and none of the dialysis centers will take anybody without insurance. So they had to go to the hospital once a week until they were very sick and get treated. They will get turned down if the labs weren't critical. I had to interpret to patients that they couldn't get treatment. I have to interpret telling patients that it was better to go back to where they're from because here in the States, they were going to die. And I couldn't do anything else. What can we do? So sorry. I'm sorry. So then that was my beginning experience. I didn't know there was anything to do. There wasn't any social workers were available, but they all speak English, so they could really never help the patients. I was finally, after 5 years or doing that job, I found a job position to work with patients with kidney disease. That kind of grabbed my attention because my family, I have a long history of kidney disease in my family. My grandma received dialysis for over 13 years in Mexico. And my dad at that point, my dad had already died, but I knew that there was maybe something something might be able to, that I could do probably something about it. Interview with Dr. Cervantes, that's when I met Dr. Cervantes. She had, I'm sorry. She offered me a job position, and that's where I saw my opportunity to work. I started the training as a navigator. We have the School of Public Health has a navigator program that I train. We did clinical shadowing. I trained with other navigators, learned how to talk to patients. And then the patient navigator training included motivational interviewing, which it really helped me understand and talk to patients. That's how that was kind of the main training the most important part of the training, motivational interviewing. I learned to listen really to the patients and find out what they needed. This work has been really important for me because of my family. My dad got diagnosed, I don't even remember when he was diagnosed with end-stage renal disease. He needed dialysis. when he got diagnosed, we were never given any options. So he started dialysis in the center. He was about that time he was a full citizen, so he was able to get benefits. And I thought, how lucky, we were lucky not to be begging for services at the hospital every week. But even like that, my dad could never, he never accepted it. He never accepted the diagnosis. I was looking at his slides, and he was all broken pieces. And I didn't know how to help him, and I didn't have the support. We didn't have the support from anybody at the hospital. We never got the opportunity to talk about transplant or to talk about other, therapies like home dialysis. And when I started working, if I knew what I know right now, my dad could have been probably alive. I could have found more support about home dialysis, about transplant. I think we got denied so much opportunities because of the information. There wasn't anybody like me looking after us. He could have been alive, really, if I knew. I think he only received like 1 month dialysis for when he started. He got his fistula, he failed. He got dialysis through the catheter, and he got real sick. At the end, he got diagnosed cancer, stage 4, and he passed away 2 weeks after that. But if we would have had control that dialysis thing and have more education, we could have helped. We could have going to the doctors to see the cancer and have preventive care for him on the cancer, early diagnosis, and we couldn't because we were concentrated on the dialysis, on the adrenal failure. So he left. He passed away in 2006, and I was working at the hospital when he passed away. So that was my main motivation on working with patients. I didn't want anybody to, nor my family, because I still, at that point, when I started working with Dr. Cervantes, my uncle, I have an uncle that is my age, and he was diagnosed at stage 5. He was ready to go to dialysis. So, I needed to learn more about what can we do if there was more resources. That was my main motivation. I started working as a patient navigator on the first study for Dr. Cervantes. We just wanted to see how patients would do with the navigator in the center. This is my patient and good friend, Rosa. What I find out is we need to, it's building that trust. Community health workers or patient navigators, their success is building that trust. We know our patients. We know where they come from. Most of my patients are from Mexico, and we share the same culture and the same, same culture, same way of thinking. This patient, she was eligible for benefits, but she had a problem. She had a problem with transportation. She was told by the social worker, she's been working with the social worker for a year when I met with Rosa, and she couldn't get transportation. It was so, She was spending $10 a day going to the center, and she couldn't spend $120 a month when her benefit check was only $400. So I didn't understand why she wasn't eligible for benefits, for transportation benefits with Medicaid. Medicaid provides transportation in Colorado. So I told Rosa, well, let's give him a call. Let's call benefits. Let's call Medicaid and find out what you need to do or why you don't get transportation. I talked to the social worker at that point, and the social worker, the social worker she only tried once to help her out, and no, there's no transportation. So we just called the benefits, met at their house, spent 45 minutes in the phone with Medicaid. At the end of the phone call, she was eligible for Medicare for transportation. After 45 minutes conversation, we find that out. She hasn't missed. Well, I don't know if she hasn't missed since I met her, but she hasn't had any problems now going to the dialysis center, going to get her treatment, and she doesn't have to pay. It's all included on her benefits. I find out that just with that piece, helping her on that piece, she was able to do better. And her quality she didn't have to worry about that. So that's what, that's the community health. That's what the community health people can do. Just one thing at a time, and they can improve their life, and everything is better. I also have, I've been working with Dr. Cervantes' studies. I probably know about 100 patients or more. From 5 different centers in Colorado, and all these patients have their stories, and I have influence somehow their care. And, again, just one thing. I just need to fix one thing, or I just need to help in one thing, and they'll do better. This is my other patient. This is, believe it or not, she is getting treatment at home. Her name is Antonia. I told her to get her face, but she didn't want to. Antonia was diagnosed end-stage disease, as many of the patients that I know, as emergency when there was nothing else to do, stage 5, when they need dialysis. She gave birth to her premature baby. She got diagnosed right there. She didn't know what was going to happen. Her premature baby needed a lot of medical attention. She was missing her dialysis treatment because she needed to take her baby to the doctors, to specialties. When I got the referral from her, the social worker, the provider told me she misses dialysis, and that's no good for her. The first time I met, I knew why, because her daughter was first. She needed to take her daughter to the doctors. She needed to, the baby was sick all the time. She needed to be at the hospital. She explored the home treatment at some point, but then she didn't have she had Medicaid, emergency Medicaid, and it didn't cover home dialysis at that moment. When I met her, I knew that some of the patients on that center had signed up for private insurance through Denver Health, and the association, AKF, will help them pay for the insurance. So I asked her what type of insurance she had. She didn't know what insurance she had either. That's another topic too, that many patients don't know what type of insurance they have. Because the centers sign them up sometimes without even telling them. So I find out that she had private insurance and she was eligible for home treatment. Home treatment was going to be kind of the solution at that point, because then she could concentrate. She can do like all night home dialysis, and then during the day she can take care of the baby, take her to take her to the doctors or what she needed to do. It wasn't that easy when we identified that she was able to do home treatment. She had to do a lot of stuff. She had to get approved by the doctor. She had to have a visit. I help on that. I help I help on that. I help on all the aspects as an interpreter, as an advocate. There was a doctor that didn't want her to be on home dialysis because she was going to miss. What was it, like she was missing here. What made us think that she was going to get her dialysis at home? I'm like, she can do it. She's missing because of her daughter, but if she goes to if she gets her treatment at home, she doesn't have to miss. She can do it at any time. After a month, we started all the process probably in August 2022, and she transitioned to home dialysis in November. So it's still, many months later, but now she's at home doing dialysis, and she couldn't be more happier. Well, as best as she can. Dialysis is not easy. It's really difficult for patients. But she's on it. She's on it, and she just needed a little bit of push, and somebody like me, a community health worker that could understand her needs. So that she is one of my. These both patients call me, often, inviting me to their houses, and I'm part of their lives at that point. I want to also share some real changes that have been happening in Colorado. Based on these experiences, the patients that I know, over 100 patients that I know from all the centers, when the patients, there is this group, very special, when emergency Medicaid didn't cover dialysis at home, dialysis in the center, patients had to go to the hospital every week. And then they create the commentary, and we, Dr. Cervantes, we did a study, an animal study, and a study where we will meet once a week or twice a week, and just get together in a room while they were admitted, and just talk about, resources, talk about education, just have a good time. Sharing some food. And from those patients, they decided to continue a group, finding resources, do activities, sell food, sell things to get money so that they can help each other. So they created this club, and it's Club Riñones Latinos. They will get together and see right there cooking, we're making chile rellenos to sell. I joined them. I wanted to be part of that. I mean, these patients are amazing. They're so strong, like with these illnesses, going to the hospital once a week. So they were my inspiration. So there you go, making chile rellenos to sell. The money that we gathered for that event was we helped a couple patients to get their premiums to pay for their insurance. So, that's what community health workers do with these patients. Then in 2018, Medicaid made a policy change. They decided to include end-stage renal disease to cover in-center hemodialysis. So that meant that the patients didn't have to go to the hospital every week and wait until they were real sick. Now they could go to a center. So that was huge. Most of the patients, I did interviews before and after, and I remember seeing the patients before getting dialysis 3 times a week, and then after, and they were completely new. They were completely different people. I felt so proud when I was doing those interviews after, because that was part of the job that I was doing, or the job that I did. That was the result. So it's very, very satisfying to go through that. And then now, just I think about a year ago, now Medicaid, emergency Medicaid also includes home dialysis, either hemo or peritoneal, which is amazing too, because now patients can do, the treatment at home. And right now, I help one of the educators, one of the Fresenius centers, to educate people on home dialysis, trying to get more people and finding out. I'm also conducting some interviews, finding out why people are, especially the Latino community, why are we not pushing like a lot for home treatment? And lastly, we have in Colorado last open enrollment last November, Colorado offered about 10,000 plans for medical insurance, called OmniSalud, private insurance through Kaiser, Anthem, Blue Cross Blue Shield, Cigna, United Healthcare, and Denver Health offer plans, private insurance at zero premium. This is income-based, zero premium, $100 deductible, and $1,000 out of pocket for individual. Huge opportunity. I was able to help enrolling patients with the community center to get all these people, to get people in dialysis, got the chance for transplant with private insurance. It's been an honor. It's been an honor helping to achieve all these changes for the health of the community. Some pictures over there with the Latino, with Buena, that's the community health center, making chiles, or announcements. And then I also help the social workers to get turkeys in Thanksgiving. So it's not just the education and talking to the patient. It's seeing you, the patient seeing you, that you are interested, that you are invested. That's what they appreciate, and they do what what they need to do, because as a community health worker, you show them that that it can happen.